welcome back to the Future Identity stage. I'm joined now by Leah Houston, the founder and CEO of HPEC. Thank you so much for joining us today, Leah. It's a pleasure to have you here.
Thanks for having me. This is really exciting.
Now, this morning, we are going to be chatting about some of the challenges for identity management and credentials in the healthcare sector specifically. And Leah, you've been a physician for many years, and I'm sure will have seen many of these challenges firsthand. So could I start just asking you to introduce yourself for the audience and tell us what I'm interested in is how did you come to focus on digital identity and to set up HPEC?
Yeah, sure, of course. So I'm an emergency physician. So I practiced across the United States for nearly 10 years, across several different health systems. And, I saw a lot of the friction and the potential fraud that comes from all of these outdated identity systems across not only different health systems, but all of the different siloed entities that you need to use. You have to log into a different system for the EHR, then for the radiology, then for the labs. I never really thought about it until my identity, my professional numbers that allow me to authenticate myself as a doctor here in the US, that allow me to write prescriptions, that allow me to sign off on charts and bill for things, were being used by a hospital when I wasn't even working there anymore.
Oh, wow. Gosh, that's terrible.
Right. So I had no control over my own digital self. They had all the control. I had to give up that control in order to work there. And then when I left, they retained control and they continued to use it. And so that led to a big, Department of Health and Human Services fraud case. It led me to, have, 5 months of stress, and it kind of opened the door and kind of shed some light on this problem for me as a physician, and allowed me to kind of consider the possibility of a solution.
That's so interesting. It's it's scary to hear that, and to hear kind of the trouble then that you would have to go through afterwards, because it really, I can imagine had a huge impact on your life and in your work as well. So I can see there's some really specific challenges in the healthcare sector, I think, when it comes to physicians and probably patients as well, identity data and making sure that data is secure and private. And you mentioned a lot about control there. So is that something that you think is important, and that maybe is a limitation at the moment, that the control that people have over their own data when it comes to physicians and patients' credentials?
Absolutely. I think that our healthcare system is on a runaway cost train. And I don't think that many systems purposely use my identity fraudulently when I'm not working there.
Yes.
But I do think if I'm not the one that's fully in control and fully in the understanding of when my services are being billed for and what exactly is being billed under my name, then it's really opening up a huge window of fraud and waste and abuse. Here in the United States, patients have to pay for their health care, either through an insurance that they've purchased as individuals or that their employer has purchased, and they receive these bills. Even people on Medicare and Medicaid receive these bills. Yeah. So they get to see what's being charged. And I've almost every single person I've spoken to who's had enough interaction with the healthcare system has seen bills for things that they know they never received. And what do? Are they going to take the time to fight it and say, no, I didn't receive that care? Or are they just going to ignore it? So we're being overbilled and overcharged for services that either were never rendered or patients didn't even know that they were rendered. And when you think about profit, driven health systems, even if they're not for profit, even if they're non-for-profit, they still are collecting money off of sick people. And so, they don't really have an incentive to make sure that everything that's there is actually what happened.
Yeah, no, that's really scary. And I'm wondering, is this something that's kind of changed or accelerated over the past few years? I know, obviously, you were working on HPEC and looking at these kind of issues before the pandemic hit. But I know throughout the pandemic, we've heard a lot about increased levels of fraud and in the healthcare sector particularly. Just wondering if that's kind of accelerated or changed anything about how people understand the need for better options for preventing fraud and for kind of protecting data, really, or was that already a trend, you think, beforehand?
I think this got worse with electronic health record systems.
Right, yeah.
I think that everything is now being documented and billed electronically. So it's a lot easier to just click, click, click a couple extra buttons. Yeah. And and I'm not saying that fraud didn't exist before, but it was in different ways. Yes. And so the ways that fraudulent things have happened have shifted. That's what usually happens when a new system is introduced. There's new ways of bucking that system. So.
Yeah, absolutely. So I'm interested to hear more about HPEC. So it's based on a model of self-sovereign identity, if I understand correctly. So why do you think self-sovereign digital identity offers such promise in the healthcare sector? Are you seeing that this model of open source self-sovereign identity standards do you think that's going to have a real impact in medicine and healthcare?
I think it needs to have an impact across sectors. I think it needs to have an impact across financial industry, the real estate industry, the education credentials and learner record industry, as well as the healthcare industry. I think it's going to be a horizontally applied technology because the same things that are happening in the healthcare system are happening all over the place. And it's not only fraud, but it's also people's right to transact, to move, to own their information, to move that information when they don't want that information to be kept by those centralized entities. We're in Europe, you guys have the GDPR, and I believe California has a similar piece of legislation here, but we haven't adopted that quite yet across the US. But it's coming, and it has to come, and they're starting to realize that without it, the potential for fraud and waste and abuse is going to continue to climb.
Mm-hmm. No, absolutely. And we've seen kind of across the day already, and we'll see in some of the panels through the rest of the day today that it really is something, as you say, that affects a lot of areas, and kind of with the individual at the heart of that. I mean, even though we do have GDPR here, and that's fantastic, I do think sometimes you still feel a little out of control of your data, even if you're more confident that it's kind of kept private and secure. You don't quite know where it always exists, and almost don't feel like you are the one kind of in control of that. Is that something as well that you think so? HPEC, this is obviously built on open sourced self-sovereign identity standards. So, and you also, I noticed, call it the doctor's DAO. So I wonder if you could kind of expand a little on that. I'm really interested to hear about that kind of concept and that crossover of decentralized, organizations with what it is you're doing.
Right. So I came to learn about this after first learning about crypto and reading every single blockchain healthcare white paper. Yes. And all of them were like, patients should own their data. And I'm like, yes, how? How is this going to happen? And I was digging into these papers, and I even got a chance to meet some of the founders of some of these companies who claimed that they were going to give patients their data. And when I asked the how, there was kind of a lot of hand waving around patients getting access to their records. But as a physician who knows how this stuff actually works, like I'm the one that actually creates the record. Yeah. I put it onto these centralized platforms. Epic and Cerner are the largest record keeping systems. They essentially own more than 51% of patient data in the US, and they control it. And in order for the patient to get that data, Epic and Cerner need to give them permission And they're kind of giving them piecemeal the pieces of data that they have to, according to the government. So patients don't have true access to their actual health records and their actual data. And there's a piece of legislation called the 21st Century Cures Act that was finalized last year here in the United States that essentially says patients need to have immediate access to their records and systems need to be interoperable so that that can be possible. And it's causing a lot of stress within systems, and a lot of doctors are feeling stressed about it because the systems were purposely built not to do that. But this is the federal government's attempt to essentially create a system where patients can have access to their records. The problem is there's no mechanism, there's no technology solution that has been offered to make sure that they can actually access their record and own it and keep it in the way that it should. And so I don't know if I answered your question. I feel like I went on a bit of a tangent.
That's how you then came on to this concept of looking at a DAO and a kind of a decentralized bit based on crypto.
Right. And so, realizing that in order for patients to truly own their records, in order for patients to have immediate control of their records, their individual doctor that created that record, that ordered that lab, that ordered that medication, that wrote that discharge summary, that operative note when they were in the operating room, that physician needs to be able to give that to the patient directly, securely, privately, without having to put it into these centralized systems. And so I realized that in order for that to happen, we have to create a decentralized identity system first for doctors.
Yes.
And, I'm a Greek. I believe in democracy. And the concept of a DAO, a decentralized autonomous organization, is something I also came across. And I realized that through decentralized identity, each doctor can have their identity, and we can use it to build a DAO, a decentralized autonomous organization, where we as physicians can collaborate to create the solutions of the future that will allow patients to have true and full ownership over their records, and that will allow physicians to have ownership over their private practices and retain privacy for their patients again.
And I imagine it would, hopefully help with the issue that you raised at the beginning, where you'd left one hospital, perhaps moved somewhere else, but that your data was still, held by that original hospital. I wonder, does it kind of help a little bit with employment mobility as well, and moving between different workplaces?
Well, that's actually our first use case. So people don't realize from the day that I'm hired by a hospital to the day I actually can start working is an average of 4 to 6 months. What are they doing during that 4 to 6 months? They're verifying my identity so that they can give me permissioned access to their centralized identity systems within their health systems. So before I'm allowed to take somebody to the operating room and cut them open and repair whatever it is that I'm repairing as a surgeon, before I'm allowed to admit them to the hospital or give them a medication, they want to make sure that I'm actually who I say I am.
Yes.
And the current system, they have to actually contact my medical school, contact my state licensing board every single time to demonstrate that I actually am who I say I am. We don't want a catch me if you can situation, So, but with decentralized identity, self-sovereign identity, I can kind of bundle and package that information and become the primary source of truth.
Yeah.
Because when I graduate, I can get a digital credential demonstrating that I graduated, demonstrating that I'm licensed, demonstrating that I have all of these credentials that allow me to do what I say I'm able to do. So when I present them to you, you see proof hashed to a blockchain that it was actually issued. And so that can happen instantaneous, shrinking down that time from 4 to 6 months to moments, allowing me to work immediately, creating employment mobility, creating improved access to physician talent. And so that is our first use case.
Wow, it's so interesting to hear the real power of blockchain technology for that use case, Leah. And in many ways, I think we do have the technology available to us now to power the next generation of credentials. But I'm wondering, What else do you think needs to change to drive progress and adoption on a wider level, and solve the challenges that we've spoken about today? Is it legislative change, enabling better systems for interoperability and data sharing? What do you think are the other layers beyond technology that we need to solve for?
Well, in my opinion, technology is adopted in two ways.
Yeah.
One is legislation and regulation forces its adoption.
Mm-hmm.
Okay, so this is what's happened with the HPEC Act of 2009 here in the United States, that basically created electronic health records and created an incentive for systems to adopt them. And so now I think it's, if you refuse to use electronic health records in your private practice in the US, you get like a 3% Medicare pay cut.
Yeah.
And then many insurances won't, they give you a cut if you don't use the EHR and stuff like that. So you have to take a pay cut as a doctor if you don't adopt these technologies because of these regulations. Now, the other way is the way that we're adopting Teslas, the way that we adopted social media.
Yeah.
It was, the way that we started adopting Uber and Lyft and all of these ride sharing programs. It was the people who created the technology, who gave it to the people, and then the people got a taste of it and loved it and demanded for it to be available. And it's the people that have really driven most of the technology advancements and developments throughout history. So I personally think that yes, the regulators can, start paying attention to this and can kind of help to shape some of the standards and put some pressure on these systems that really have they have no incentive to create these solutions. They can put some pressure on them to adopt them. But I also believe it's we, the people, the practicing doctors who want sovereignty and agency over the patient relationship again, who want the right to move and have employment mobility, who want to create opportunities for privacy for their patients. We need to adopt it.
Mm-hmm. No, absolutely. That makes complete sense. And I think that we've shown, over the past couple of years, how fast technology really can be adopted when there's kind of that push to do so. I don't know what sort of you've had in the way of contract tracing rather apps in the States, but I know here in the UK, like the speed at which we adopted apps and things like QR codes for contract tracing when it came to COVID, it was just kind of mind blowing when you consider the speed at which some other innovations had been kind of moving along before that. So perhaps that comes to the second way that you were saying of adopting technology rather more quickly. Yeah, I wonder if that would have an impact. Sorry.
No, of course. I mean, the concern with that is if it's not the people choosing to adopt it, then you have a centralized entity making all of the decisions. Mm-hmm. And so, there was a lot of people that came in with these solutions during COVID. Yeah. Some of them were very privacy preserving. Some of them were very user centric. And some of them were not. And if you're forced to adopt something in order to be able to go to the grocery store, and that thing that you're being forced to adopt is not safe for you or your family, and you're now having some surveillance over your personal private life, it's not a good thing. I kind of followed it very, very superficially because I'm in the space. And there were some very, very good privacy preserving solutions that were being considered. And then there were some that weren't. And here in the US, there were some states that adopted these and some states that didn't. So it made it, not very useful. If one state doesn't accept it and you're flying to the other state and it does, how does that work? So
lots of challenges highlighted as well, and lots of kind of risks for that privacy element, I think, and I think that's so important what you say about it coming from the people. I think that's really interesting to actually look at the driver of the technology being adopted.
And that's the beautiful thing about self-sovereign identity.
Yes.
And we aren't here yet. We haven't reached true interoperability yet. No. It's a challenge.
Yes.
But once we do solve the problem interoperability, it's not going to matter which one you use, as long as it's a truly self-sovereign system. You can use this system or that system and port your data. That's the real kind of holy grail of interoperability, which means that even if your state uses this system and the other state uses this system, the protocols in the back end allow them to talk to each other. That is the true power of self-sovereignty when it comes to these kinds of things. So that's what I have my eye on, and what I think many people in the industry are hoping for.
That's so funny. I was going to say to wrap up, I'd love to ask what kind of exciting developments you predict and what have you sort of got your eye on, but you just answered it there so perfectly. Yeah, I think that's, as you say, we're not there yet, but that's almost what you're driving at, and yeah, it's really exciting to hope that might be realized sooner than we think, hopefully.
Interoperability is where it's at, you know. And yes, I'm a founder of a company, and yes, I want physicians to adopt this system, but I want them to adopt it so that they can have agency and autonomy and privacy for their patients. And if the system that we build isn't working for them, I want them to be able to leave. Yes. And I want to build it in such a way that they can. And so that's a major thing that we are going to be pushing for as we build these new technologies.
Absolutely agree. Well, thank you so much for joining us here. We are almost out of time for this, unfortunately. I could talk to you all day. It's so interesting and yeah, really great to hear that kind of vision and yeah, everything that you're working on. It's fantastic. Thank you so
for
much
having me in.
No, it's been a pleasure. Lovely to see you here today.
Likewise.
Thank you very much.